Out of Intermountain Medical Center has found that depression can increase the risk of death in heart patients. With more on that, we're joined now by Dr. Heidi May with Intermountain Medical Center Heart Institute. Dr. May, great to have you with us. Thanks so much for being here.
Thanks for having me.
A very fascinating study as we've been talking. I've really found it very interesting, but talk about how this all started. How did you go about this study? What did you do? What were you searching for?
Sure. So we've looked at depression and its association with heart disease for quite a few years. And so we decided, well, how does getting diagnosed with depression affect someone's risk for mortality after they get diagnosed with coronary artery disease? Is a diagnosis closer to their heart disease diagnosis worse than if it happens a few years or many years after? So we wanted to see if there was kind of an effect, and what I anticipated to be more of an effect if you were diagnosed closer to your heart disease diagnosis rather than if it took a few years. But we found that risk was fairly constant throughout follow-up. That whether it was 4 years, 5 years, 9 years.
And what was the main takeaway? How much more does it increase the risk of death?
So it increases your risk twofold. So someone diagnosed with
very significant.
Depression compared to someone without.
Okay. Are we talking chronic depression or even short-term depression here?
Yeah. We just looked at whether they got a diagnosis of depression and how long that depression lasted. We didn't evaluate.
And I would imagine just the very fact of being diagnosed with heart disease can actually lead to depression because, you know, a lot of circumstances you don't know what's coming, and that can be devastating as well. So what was the connection there? Yeah,
so we know prior studies have shown that depression, heart disease, there's a bidirectional relationship where one can lead to the other, and it certainly is rather depressing to get diagnosed with heart disease. You know, it's a life-changing experience, and some patients have, you know, physical limitations from it, and a whole gamut of things that change in their life. And so that's why we thought earlier on depression diagnosis would be worse than if it happened a lot later.
So if someone was diagnosed with depression earlier in life and then later became diagnosed with heart disease, was there a connection there? Did that matter?
No, we actually looked at patients that way. We looked, did it affect your risk of death if you'd had a depression diagnosis prior or if you didn't, and that twofold risk remained in both populations.
Interesting. So bottom line, what do we learn from this study that can help doctors in treating those with both diagnoses?
Yeah, so screening is really important. You're never out of the woods, no matter how long it's been since your heart disease diagnosis, and so it's important to continually get screened.
All right, where can we learn more about this study and more about Intermountain Medical Center Heart Institute?
Well, we have a research website that should have links to many of our studies that people can learn more about. All
right, and there's the information there on your screen, intermountainmedicalcenter.com. Dr. May, very fascinating study. Thank you so much for being here and helping us learn more about it. We really appreciate it.
Thank you.
You bet.